Good morning, good morning, good morning. I'm Dr. Tim Joshin. Today we're going to talk about Restylane Silk, and Elaine, our nurse practitioner, is going to be injecting me today. So we are going to be injecting Restylane Silk. Restylane Silk is a little bit different than Restylane or Perlane, which is the family of hyaluronic acid products. The Restylane Silk is just a smaller particle. So what that means is that it means it can go into fine lines and wrinkles better than some of the bulkier products. So this is a great treatment. Now, we're going to be putting them into the fine lines in my neck. The neck is an area that starts to bother people when they get to about 45. And so I think this is just one of the nice treatments that we can do for our neck. Some of the other things, if you look at my neck right now, I just recently had a sublative treatment, which is a radiofrequency device that helps to shrink and tighten the skin as well. And then I also do multiple other treatments, including Vela shapes that help to shrink and tighten the skin as well. I've done CO2 laser to improve the tone and texture. And so this is just one of the things that we can do. So if you have neck issues, I really highly encourage you to come into Contour Dermatology and talk to us about your treatment options. So Elaine is going to get started here.
Put alcohol here.
So Elaine's just cleaning me off with a little alcohol. And Elaine's a great injector. She does a lot of my injections. And so what she's going to do now is she's just going to slide the needle just underneath the wrinkle, and then she gently pulls out. And this product is great because it also lasts for approximately 6 to 9 months. With repeated injections, you can get longer duration. Now, there really aren't a lot of risks associated with doing this treatment, and you can see it's not very painful for me because it's got a little lidocaine in it, so I'm not suffering at all while she's doing it. And I'm probably the biggest baby in the room.
Yeah.
Anybody who's tried to give me a vaccination knows. But yeah, it's got lidocaine in it, so it doesn't hurt very badly. The only real risk with this is that you could get a little bit of bruising. Bruising, if you get it, lasts for typically 1 to 2 weeks. Other than that, if you ever were to get a little knot, most of the time it's just an injection phenomena caused by a little swelling from the injection. But you can always just massage the bleb out over time. There's really not a lot of aftercare instructions. We will tell patients if they get multiple injections to use ice 10 minutes on the hour until they go to sleep. That just helps to constrict blood vessels, so it decreases your risk of bruising. How's it going, Elaine?
Good. How's it feel?
It doesn't feel bad at all.
Trying to get some of the lines here.
And trust me, I'm the world's biggest baby. I have a vaccination I have to get, and I've been postponing it for a month because I don't want to do it. But if you're injecting my face to make me look better, or my neck, I'm in. Right away.
Did you say there's a numbing solution in there?
Yeah, this has lidocaine in it, so it doesn't hurt as badly. And the more times the needle goes in, the less it hurts. Do you want me to turn this way for you? Or do you want to go on the other side?
Okay.
Now we also will use, I mentioned some of the other treatments. I also like Derma Rollers after fillers. And Derma Rollers are just pinwheels. And what you do is you just roll this device that has little pins on it over where we've injected. And I really think it helps a lot to improve fine lines and wrinkles. And it may break up the collagen underneath of it. It may stimulate new vessels to form there to rejuvenate the skin. But I think it's a great combination. We always like to numb patients before we do the Derma Roller because it is a little bit uncomfortable. For the Derma Roller, we'll just do a little bit of topical numbing with lidocaine. Great. Is that it? Mm-hmm. Beautiful. Thank you. And that was just 1 cc. So thank you, guys.